In this class, let us learn about two more developmental bone disorders, namely Pagets disease and hyperparathyroidism. Firstly, we'll talk about Pagets disease. The synonym or the other name for Pagets disease is osteitis deformans. It is basically a disorder of increased bone mass, but however, since the bone mass is not well arranged or disorganized, the bone is structurally unsound and it can undergo fractures. Coming to the mechanism of Pagets disease, it is a disease for which cause is not very well known. However, some causes are said to lead to this disease. Some are genetic factors, some are environmental factors. Genetic factors are implicated in Pagets disease because 40 to 50% of the cases are said to be familial in nature. And some mutations are identified which can lead to Pagets disease, particularly SQS-TM1 gene mutation. It's also called sequestosome gene. Whenever this gene is mutated, it causes excessive activation of osteoclast cells, which then give rise to various findings in Pagets disease. Among the environmental factors, certain infections are said to cause Pagets disease. For example, this viral infection called measles. So the causative factors we saw till now, what they do is they cause activation of osteoclast cells, and we all know that the function of osteoclasts is to resorb bone. So whenever osteoclasts are activated, they start resorbing the bone, leading to bone weakness. There are three phases for this Pagets disease. In this Pagets disease, the first phase is called the osteolytic phase. So in this phase, the osteoclast cells are very active. The second phase is called the mixed phase. Here, although osteoclastic cells are there, osteoblast cells will compensate by trying to lay more bone. Phase 3 is the osteosclerotic phase or the burnt out phase. So here what happens is there will be islands of bone that has been formed by osteoblast cells. We shall see about the details of these three phases when we discuss the morphology of Pagets disease. Moving on to some of the features of Pagets disease, the age group that is commonly affected is late adulthood. The average is said to be around 70 years of age. However, it was seen that in US population, in the whites, the disease was found starting from 40 years of age also. And racial predilection is there here. It is more common in whites and very rare in Asians, including Chinese, Japanese, Indians, etc. It involves single bone in 15% of the affected populations. This variant is called the monostotic variant of Pagets disease. If more than one bone is involved, then it is called polyostotic variant of Pagets disease. The commonest bones to be involved by Pagets disease are axial skeleton, especially around the hip joint, namely pelvis, femur and lumbar spine. On examination of the patient, the history that will be given is one is pain. The pain is due to first is cranial nerve or any nerve entrapment in the bone, that is one thing. Second is pain can be explained by microfractures in the bone. Other symptoms include lion face, that is enlarged skull, anterior bowing of femur and tibia, symptoms of fractures, and stooping of the patient anterior, that is kyphosis. This is basically because of fractures in the vertebral column. Paget's disease of the bone can be diagnosed on X-rays by the appearance of the bone, which will be thick, enlarged and deformed, both cancellous as well as cortical bone. If you do biochemistry analysis, there will be elevated serum alkaline phosphatase, which is suggesting the osteoclastic activity. However, the specific finding for Paget's disease is that calcium and phosphate, those will not be elevated. It will only be elevation of ALP. Let us now discuss the morphology of Paget's disease. This will discuss under the 3 phases which I have already mentioned. The first is osteolytic phase. In osteolytic phase, the dominating cells were osteoclasts, and the function of osteoclasts is to resorb bone. So osteoclasts will keep resorbing the bone and they'll create what are known as resorption pits. So that is the hallmark feature of osteolytic phase. In the mixed phase, what happens is, although osteoclasts are there, more number of osteoblasts will come and they'll start lining the bone. Once they start lining the bone, they'll lay bone. So at this point of time, if you do alkaline phosphatase, perhaps it would not be as elevated as it would be in the earlier osteolytic phase. The third phase is the osteosclerotic phase. So here what happens is, the patches of bone that have been laid by osteoblasts, they become lamellar. However, it's not one single stretch of lamellar bone. Instead, it is multiple patches of lamellar bone. So that is why the appearance here is said to be resembling a jigsaw puzzle. That is why it is called jigsaw puzzle appearance. Here you can see the actual microscopic image of Paget's disease. This is taken in the osteosclerotic phase, which is why you are seeing the puzzle shaped appearance, which is actually multiple patches of lamellar bone. The complications of Paget's disease are that it leads to multiple tumor and tumor-like conditions. For example, osteoclastoma or the giant cell tumor, or osteosarcoma, or sometimes even fibrosarcoma. There is a tumor-like condition which is giant cell reparative granuloma, all these things. So Paget's disease can secondarily give rise to various tumors. The next entity we are going to discuss is hyperparathyroidism. Before dealing with the disease itself, I would like to introduce this parathyroid hormone to you. So this is secreted from 4 glands that are located at the posterior edge of this thyroid gland. And the function of this parathyroid hormone is to basically increase serum levels of calcium. And it increases the serum level of calcium by 1, resorption of bone, 2, by increasing the tubular absorption of calcium from the kidney, and 3, by inducing the kidney to produce vitamin D, which helps in additional gut absorption of calcium. So naturally, if there is excessive parathyroid hormone, it will keep on resorbing the bone to release calcium into the serum, correct? Which leads to skeletal deformities, causing fractures and some other morphological changes. There are 2 types of this hyperparathyroidism. The first one is known as primary hyperparathyroidism, and the second one is known as secondary hyperparathyroidism. Coming to the mechanism of hyperparathyroidism. So first we'll talk about primary hyperparathyroidism. So primary hyperparathyroidism is the disease, is the type of hyperparathyroidism in which those 4 parathyroid glands that you saw are acting autonomously, not paying heed to any feedback mechanisms. So the cause of primary hyperparathyroidism could either be a tumor, the commonest one being parathyroid adenoma, or it could be parathyroid hyperplasia. The next one is secondary hyperparathyroidism. Secondary hyperparathyroidism, the mechanism is a bit different. It is caused due to kidney failure. Because of kidney failure, what is happening is kidney is not able to produce vitamin D. And because vitamin D is not being produced properly, calcium homeostasis has gone haywire. So whenever there is reduced calcium, parathyroid hormone comes into play so that it can increase the calcium, right? And because parathyroid hormone tries to increase serum calcium, it will remove calcium from the bone, leading to skeletal deformity. So this is an easy way of remembering the clinical features of hyperparathyroidism. Bones, stones, abdominal groans and psychic moans, all rhyming. So bones suggest that there is bone pain due to microfractures in the bone. Stones suggest kidney stones. During my college days, it was taught to me that if a patient comes to you repeatedly with kidney stones, then you always have to exclude parathyroid cause, because it is known to cause recurrent renal stones. And if you ignore it, you may treat the patient for stones once, but he'll develop it again. Abdominal groans are because of constipation, nausea and vomiting. Then psychic moans, because hyperparathyroidism leads to depression. Then there are additional features which include features such as edema or anuria, oliguria, etc. These are features of secondary hyperparathyroidism which occurs due to kidney failure. Coming to the morphology of hyperparathyroidism, there basically is generalized osteoporosis because calcium is being removed from bones all over the body. However, this osteoporosis is severe in phalanges, that is digits of fingers and toes, and vertebral bodies. If you see bones affected by hyperparathyroidism under microscopy, you'll basically be seeing osteoclasts which are burrowing into bones. So the name given is dissecting osteitis. In this image, you are seeing one bone, which is the pink layer on top and below, and in between that you are seeing some pale pink stuff which has multiple cells. So those cells are nothing but osteoclasts, and they are there suggesting that the entire bone has been burrowed by them. Another morphological finding in hyperparathyroidism is the brown tumor. So basically what happens is when a bone undergoes repeated microfractures, there will be some collection of blood along with it. And this blood over a period of time alters and becomes hemosiderin. From hemoglobin to hemosiderin it becomes, imparting a brown color to the entire thing. Eventually, this entire lesion, it can undergo cystic degeneration. Multiple small spaces can develop within it. And also, since blood and hemosiderin is being collected, macrophages will come and try to eat it up. And along with macrophages, some fibrous tissue also gets deposited. So this entire spectrum comprises what is known as the brown tumor. And like I said, brown color is because of hemosiderin deposition. There is one term that you will get to hear when you read about hyperparathyroidism, that is osteitis fibrosa cystica. So it is the term that encompasses generalized increase in bone activity along with brown tumors with cystic changes, which is seen in the setting of hyperparathyroidism.